Silver has always been considered to be valuable. It's been made into jewelry since prehistory. It's been used as doubloons, coins, and has even become synonymous with runner-up at all sorts of sporting events. But silver is also something else, unrelated to its relative shininess and aesthetic beauty. It's also a very strong antibacterial, capable of easily killing all sorts of tiny single-celled organisms. However, its use as an antibacterial has been limited because it can also be very harsh on human cells. That's where Ankit Agarwal comes in. He's a postdoc at the University of Wisconsin who has developed a way to use silver to heal with less infection. I spoke with him earlier today.
We'll start actually with talking about a little bit of wounds.
Sure.
Why wound infection is important. So there are different types of wounds and different types of patients. And the current approaches to heal those wounds do not address all types of problems, especially in chronic wounds for patients with diabetes or venous ulcers. The wounds take more than several months to heal, and wound infection is the main problem in the healing process. It severely impairs the healing process. And silver and silver-containing formulations, they have been used historically for treating wound infections as an antimicrobial agent. Silver ions are positively charged, and they can get across the membrane of bacteria and kill the bacteria very effectively. The current approaches that are used to deliver silver into the wounds, they involve delivering very large quantities of silver into the wound. And that is why those approaches, while trying to address the wound infections, they also end up causing tissue toxicity into the wounds. And so we are working on developing new approaches with which we can harness the antibacterial activity of silver without causing any impairment of healing of the wound.
Oh, fantastic. And just straight right into that then, basically the answer seems to be a technique of using less silver. Can you explain what you've been able to produce?
Regarding the technique of using silver, I would like to highlight how what we are doing is different from what is available. Currently, silver is delivered into the wound from the wound dressings, and these microscopic dressings, they act as large reservoirs of silver, which deliver very large quantities of silver into the wound, because silver has to diffuse through the dressing required, which results in deposition of very large quantities of silver in the wound bed. And in contrast, our approach involves immobilizing the silver in the nanometer thick polymeric films that integrates right into the surface of the wound bed where the activity is needed. So the silver, which is immobilized now in the wound, is released only locally onto the surface of the wound and provides antibacterial activity. And so this immobilization allows use of minimal loadings of silver and precise delivery of silver right where it is needed.
This is still in the research phase, I guess, of how long is it? Do we have to wait until this kind of treatment can be used on humans?
Yeah, that's a very good question. So we have shown in laboratory research using mammalian cells that are involved in healing and using the bacterial streams that are found in the infections that using only 0.4% of the amount of silver that is currently used in wound dressings available commercially, we can kill 99.9999% of the bacteria. And that concentration of silver does not kill the mammalian cells at all. Mm-hmm. So these are the results in the in vitro studies. And of course, there is a big lag in translating the results from the laboratory dishes into the animals. And currently, we are working on doing experiments in the animals. And I believe it will be over the next few months that we will be done with experiments in animals and look for FDA approval, and by the end of 1 year from now, we can be into human clinical trials.
So relatively, this is actually moving pretty quickly, isn't it?
Yes. So this is a biomedical device type of approach in which, and it's relatively faster than therapeutics, in contrast, I would guess.
No, terrific. I guess, is there anything else that you would like people to know about this research or where this is heading? Anything else you'd like to add that I might have not asked?
Yes, I want to first acknowledge the funding for this project that I was working with. And so this project was funded by Wisconsin Institutes of Discovery. It was a seed grant from that institute. And this work was conducted in a multidisciplinary team at UW Medicine, which involved scientists from School of Veterinary Medicine, School of Medicine and Public Health, and Department of Chemistry, besides my own advisor from the Department of Chemical and Biological Engineering, Dr. Nicholas Abbott.
That was Ankit Agarwal from the University of Wisconsin-Madison.
And now for a roundup of the news in brief, it's tonight's Backyard Beat.